So I'm Dr. Rutherford, and this is a seminar on, we do a series of seminars. We do them on a lot of chronic pain issues, and we actually consider dizziness, vertigo, and balance kind of a chronic pain issue. But whether you consider it or not, that's what we're going to talk about tonight. Dizziness, vertigo, and balance. And deafness. You have Meniere's?
I'm just asking you to speak up a little.
I'm going to. Okay, you bet. So, and I have, you know what? And I have a little bit of a sore throat. I was going to actually put on the last days of this, I was going to put a lozenge in there, but I didn't want to be going sucking on this thing while I was talking to you. But I'll do my best to speak louder. So I'm a chiropractor. Okay, I'm a chiropractic physician. I say that because that's what our designation is on the board, and a lot of people, first of all, say like, you know, what's this chiropractor know about dizziness, vertigo, or balance problems? He's not an audiologist. He's not a neurologist. He's not whatever anybody is you've been to that frankly hasn't been able to fix you. And I've been doing this for about 31 years. I've been a member of the board of examiners. I've done just about everything there is to do in chiropractic here. I had a radio show at one time, interviewing people from all over the world on these very subjects. I wrote a book. I'm not here to sell you books. As a matter of fact, this is the only one I got right now. Wrote a book that basically is the basis of what we're going to be talking about. And really what the book says is, this is how your body works. This is how it breaks down. This is why, and this is how and why it can get better. I don't know if many of you realize or believe that you can get better from dizziness or vertigo or balance, but almost all of you can. I mean, our experience has been 95% of you can get better. As chiropractors, we actually get a greater, I don't want to say greater, we get more in-class hours than a medical doctor gets. They get a better internship than we get. But in our in-class hours, I have another degree in clinical anatomy and physiology. And we get a big background in nutrition, which we're going to talk a little bit about. And we get a big background in neurology, all right, which I'm involved in. I had one of the top neurological teachers in the country at the time. This is Dr. Gates. He's a staff member here. He is a board-eligible chiropractic neurologist, which is kind of a new field. It's kind of a new field that we're putting together here. There's maybe 400, 500, 600 of us evolving, and it's kind of interesting. So we have the background to do this, and frankly, one of the biggest reasons that we can do this as chiropractors is because, frankly, the people who figured all this out were two pretty brilliant chiropractic neurologists, Dr. Carrick and another named Dr. Karazian, and they are my mentors and Dr. Gates' mentors. So this is something that we've been doing for a while. I've been in practice for 31 years. I've done a lot of dizziness and vertigo and balance problems. Frankly, we rarely miss on these. I'm not here to sell you on this, but I will say this. Usually by the end of this talk, there are several people here that's probably going to want to be our patient. This is like what happens, okay? And that's kind of sort of half the way we do this, but it isn't, it's not. We do dizziness, we do vertigo, we do balance, we do peripheral neuropathy, we do kids, we do ADD, ADHD, we do autism, believe it or not. Autism can be helped, like dramatically. We do a lot of things, so we don't have, and these cases are very complex, and they take some time and some effort, as you're going to see in a few minutes. And so the unexpected event here was at the end, people would start coming up and going, can we be a patient? Can we be a patient? And the answer is maybe, maybe. I don't want to say we're kind of selective, but we are kind of selective in a sense that, we can help people with these if we do a proper evaluation and we understand what the person's neurology is all about and what their metabolic systems are about. And we only take so many a month, okay, because they take a lot of work to work them up and figure it out. Frankly, once you figure it out, it's not that hard to take care of, but the taking care of is in the figuring it out. So, and what we found was a lot of people came in and they were just kind of kicking our tires. They wanted to come out and see if we actually knew what we were doing, or they'd want to tell us what their medical doctors thought, or they want to tell us what their audiologist thought, or they want to tell us what the Mayo Clinic thought. And I don't mean to be disrespectful, but I'm not really interested in what they think, because that's why you're sitting here, because you still have the problem. So we get a lot of people would be wasting our times. In the meantime, you'd be taking up places for people who really wanted to get better. So I don't mean, so I want to be impolite, but at the end of this meeting, because it struck me like people actually get up on a Wednesday night and come out and are interested to hear about dizziness, vertigo, and balance, and by a chiropractor. So you must want to know what's going on. So we do a kind of a special offer at the end of this for those of you who might be interested in getting evaluated. If you're not, you won't hurt my feelings. If you want to go check it with your medical doctor, that's fine. But don't waste our time with that, okay? If you decide that's something you want to do, we'll kill ourselves trying to help you. So, so just listen to it with that thought in mind. If you feel like what we say makes sense and you want us to evaluate you, we'll give you a nice special offer at the end, and if you don't, that's fine. You'll have a lot of data to go out there and go on the internet and all that kind of stuff. So dizziness, vertigo, balance, okay? How many people think it's an inner ear problem? That's all? Okay, good. Everybody should have put their hands up, I would think, okay? All right, am I talking loud enough? I'll talk louder. I do have a little story. Okay, so how many people think it's an inner ear problem? A lot of you put it. Dizziness and vertigo and balance. I won't say it's not an inner ear problem, but it's not only an inner ear problem, okay? In fact, the inner ear generally, unless you have an absolute direct infection or a tumor or somebody came up and smacked you in the ear, is rarely the problem. Now that bears repeating, okay? Dizziness and vertigo and balance problems are not only an inner ear problem. They are a complex net of problems that come together. There are neurological problems, there are immune problems, they are nutritional problems, there are hormonal problems, and frankly, there can be a lot more. There can be iron problems, there can be anemia problems, and I'm going to explain all this over the next hour or less, okay? And so the new data out there looks at this, and there's hundreds and hundreds and hundreds and hundreds of studies to back up what I'm going to tell you tonight, okay? We're not making this stuff up. The new data is out there pretty much indicates that it's not a sinus problem, it's not an ear problem, it's this complex issue of problems. And the nice part about it is it doesn't matter how long you've had it. It doesn't matter what your tests say. We've had people come in here with their tests and it says, oh, my tests are normal. Well, if they're normal, then how come you can't walk? Okay? You know, it doesn't matter if you've been to the Mayo Clinic. We've had people here who've come from the Mayo Clinic and they've come from Johns Hopkins, and you guys have met them all today. Okay? Dr. Erickson's here from Denver tonight, and he's getting involved in this. Okay? So it doesn't matter. It doesn't matter how long you had it, because no one's looked at you the way that you need to be looked at. Everybody's looked at you as it's an inner ear problem, okay? And it's not primarily, most of the time, an inner ear problem. So one of the things that differentiates the new thinking from the old is you have to look at the person individually. You can't look at the person, you have to look at the person individually, and you have to look at all the systems of the body. Every one of you who has dizziness and vertigo and balance problems may have a slightly different makeup. It is not a one-size-fits-all type of deal, and that's why you have so much difficulty getting any satisfaction anywhere. So we talked about it being neurological, hormonal. There's a lot of different imbalances that come together and that create this situation. So we tend here to embrace a model called functional medicine. Okay, and again, I'm not trying, let me just say, I'm not a medical doctor. I just want to make that clear. I don't want people thinking I'm trying to be something like that I don't want to be anyway. Okay, and I don't have anything against medical doctors. It's just not going to work for you. All right, so I was going on to the fact that there are a variety of different things that cause it, and you have to look at everybody individually, and we embrace a model called functional medicine. What that means is that you need to look at all the different parts of what can cause your body to be imbalanced and see what's functioning right and what's not functioning right. So we don't use a generalized diagnosis. Like, we're going to talk about vertigo and dizziness and balance because we have to use those terms to communicate. But we like to look at something called a functional diagnosis. So you come into me and you tell me you got vertigo. What does that mean? We're going to talk about 8 different types of vertigo here before this is over tonight, okay? What does that mean? It really doesn't mean anything to me, okay? It means that, and if you tell me you got dizziness, it means even less, because people really like dizziness. What does that mean, okay? You come into me with a generalized diagnosis of dizziness, or if you go to your doctor with that, It's not like going to your doctor it's not like going to your doctor with a diagnosis of pneumonia. And they're going to give you an antibiotic, and in a couple of days you're going to start to feel a lot better. And it's not like that. Okay? It's such a variety of different things. So we look at something called functional diagnosis. How's your brain working? Your brain has a lot to do with this. How are the systems of your body working? Okay? Your systems of your body can feed back negatively to your brain, and if you don't fix those, you may never get better. Okay? How are other things working? How's your musculoskeletal system working? Do you have a flat foot? You have a short leg? Are you tripping? Is that what has to do with it? So you have to look at everything. That's called functional diagnosis. So we're very specific. You're going to hear me use that word a lot because every single one of you is slightly different. So we may diagnose you as having a parietal frontal cerebellar lobe problem in your brain. Okay? That's causing a dysfunction of a bunch of mechanisms that are negatively affecting your ear. And if you have that, then it's creating an imbalance that you might call dizziness, vertigo, or whatever you're going to call it. Okay? We might diagnose you as having something called a Th1 or Th2 dominant autoimmune attack. And those are words you've never heard of. But those are words we use around here all day long because a lot of you have it. A lot of you have it. Probably 40 to 50% of the people in this room have what I just got done saying and don't know it. And it destabilizes your neurons, and if you have an imbalance in your brain, it makes it almost difficult for your body to calibrate itself, which it's trying to do. Your body was meant to be better. It wasn't meant to like suddenly get out of whack and then stay that way. The question with this group is, why is it staying that way? Or we might say that you have a stage 7 adrenal exhaustion syndrome, which we do a specific test for, which has to do with your blood sugar, has to do with your cortisol levels. What could that have to do with it? Well, it destabilizes neurons in your brain and in your inner ear and in your cerebellum, and we're going to talk about all of this and make it a lot more clear. So this is functional analysis. And you've got to look at all the different parts, and once you find which different parts are not functioning, get them to start stabilizing better, dizziness goes away, balance goes away, vertigo goes away. So it's a different way of looking at things. You're looking at what is the mechanism? What do we have here? What is it that's causing us to function? So say we have this parietal cerebellar problem. What can we do about that? There are ways that you can rehabilitate it. There are ways that you can strengthen it. We're going to talk about your brain a lot here in a few minutes, and one of the things I need you to start thinking about tonight is we're the only animal that has two sides of the brain that have to integrate. I don't know whether you realize that or not. We have two completely different sides of the brain. One does one thing, one does the other thing, and they have to work in sync. And if they're not working in sync, you can get a lot of things. And three of the things you can get is dizziness, imbalance, and vertigo problems, okay? And so we'll look at that, but I want you to start thinking your brain as a set of muscles. And what's happening in a lot of you is you have certain sets of muscles that are weak. And you have certain sets of muscles on the other side of the brain that are strong, and they're not in sync, and we're going to talk about that in a minute. But you can rehabilitate those brain muscles, neurons, those brain cells. They can be rehabilitated. You can also find the imbalance in the systems of whether you have too much iron, too low iron, blood sugar problems, whether you have autoimmune, and you can balance those out for the most part if they're not too far gone. And you can do it with diet, you can do it with dietary recommendations, you can do it with powerful supplements, nutraceuticals. It just depends on what's right for that person. All right? That's what you call functional medicine. You step back and you look at everything at once. We've gotten into a part where we just go to the doctor and the doctor looks at, we're going to look at your ear, okay? And the other doctor is going to look at your brain. He's going to do an EEG, and the other doctor is going to look at your right toe. That's not how it works. Your entire body works together. Your brain runs what? Everything. Everything. Your brain runs everything. If you get a dysfunction in your brain, and we're going to make that point, that most most balance and dizziness and vertigo problems are primarily start in a dysfunction in the brain. As a matter of fact, we'll talk about that right now. The latest study, the most critical research that is out there now, is out there indicating that these problems come from something called a functional disconnection syndrome. Now, for you guys that are computer nerds, you can go out there and actually look this up. All Right? They're having conferences on it all around the world. There's hundreds of studies on it. And functional disconnection syndrome is this. We talked about your brain, okay? And you have two sides to your brain. And it's kind of interesting, okay? They're different. Right side of your brain is like the negative brain. It's like the sad brain. It's also the brain that's kind of the brake pedal. It likes different things. It likes music. It likes soft music. It likes the ocean. It's the left side of it's more artistic. The left side of your brain is like the student part of your brain. This is the academic part of your brain. This is where you learn how to add, subtract. It's where you get your words. You actually have a center here that hears your words. You have another one that modulates them. It's what causes you to actually speak. This side of your brain reads body language. This side of your brain speaks. You can't speak until you read body language. Now I'm getting into my autism there. But the bottom line is you have two completely different sides. And they need to coordinate, okay? And most of you, those of you who are here who have these conditions, okay, they're not coordinating. I will guarantee you absolutely 110% for sure, if you don't have an inner ear infection or a tumor in there, your brain isn't coordinating. And it's called a functional disconnection syndrome. Now, here's what you got to get. This is an electrical syndrome, okay? So there's a lot of stuff out there today. People are telling, I take magnesium, I take B vitamins. It's not that. It's an electrical imbalance. It's not a chemical imbalance. So one part of your brain starts not firing right, and it gets weak. And it gets weak. And the wiring is there. It's just not working at 100%. And something occurs that it gets weak. Maybe you have a trauma. Maybe you have a stress. Maybe you get sick. Maybe you have a birth. I mean, maybe you get an overwhelming infection in your gut. All of these things can feed back to your brain and set it off. And maybe it recalibrates itself. But in anybody who's sitting here who has the vertigo or the dizziness or the balance, your brain has not recalibrated. And one of the things that we have to figure out is, do you have it? Which side is on? Why is it not recalibrating? Because that's what your body was meant to do. Your body's meant to balance itself at all times. Your body's meant to heal. That's one of the things I talk about in the book. Your body's meant to get better. Why did yours not get better? So we have this functional disconnection syndrome. The best way I can explain it is to use an example of let's say, like a symphony orchestra. You go in, you listen to the symphony orchestra, and everybody is supposed to be playing what? In sync, in rhythm. Everything sounds beautiful. You're sitting there, and all of a sudden, like the horn player goes, eh, or he decides to start playing like Al Jolson or something, you know, and everybody else is playing like Mozart. Literally, the other people in the band cannot play. Eventually, they cannot play because it reprograms their brain, okay? That's what's happening in your brains, all right? That's what's happening. It's called a functional disconnection syndrome. And it's well documented, it's well known out there. A lot of doctors don't know about it. A lot of doctors, if they knew about it, they wouldn't know what to do with it because it's not in the medical model. Now, you got to understand something. I'm not here to bag medical doctors. When we talk about our medical system, you know, and people argue over whether it's the greatest or the worst in the world, it's both. I mean, if you get hurt and you have an acute critical problem, this is the country that you want to have it in, let me tell you. This is the place you want to be. But for chronic pain syndromes or for these types of conditions, that model doesn't fit, okay? It doesn't fit because we're talking about a multi-sensory, multi-organ model, and one drug isn't going to balance all these things out. So you have a functional disconnection syndrome, and at some point in time, you have this band that's not playing, suddenly it goes out of sync, these neurons aren't working, this is getting work, and it starts to cause all kinds of symptoms. Depending on the pattern, it can create balance problems, or it can create a bunch of other different things, or vertigo problems, or dizziness problems, or so on and so forth. The latest research also shows that we have something called autoimmune attacks that are very, very prominent. They're becoming very well understood now. It's an explosion out there. These autoimmune attacks are nothing to be messing around with. What an autoimmune attack is your body starts to not recognize itself, and it starts to attack itself. There's going to be people here in this room that have autoimmune thyroid problems that don't even know that they have them. And if this is something that you decide to check out, we'll find it if it's there. It's huge. It's absolutely huge. But you can have autoimmune attacks where your body starts attacking any type of tissue. It can attack your pancreas cells and give you blood sugar issues, and it can attack your liver. In a lot of your cases, you can have either thyroid autoimmune attacks or neurological autoimmune attacks. A lot of you will have autoimmune attacks on your cerebellum, and we'll talk about why that's important. It's a nerve tissue, and it'll actually attack your cerebellum, and it'll cause those neurons not to work. We're going to talk about the cerebellum later, because the cerebellum is about 500 times more involved in balance problems than the inner ear. Okay? So we know that we have autoimmune attacks, and these things are not to be messed around with, and they can be set off by a virus, an inflammation, an insulin dysregulation attack, diabetes attacks. They can be set off by a number of different things. They can be set off by high blood sugar spikes. They can be set off by low blood sugar spikes. And once they're set off, they're there, and they don't go away. I don't know if many of you realize, but all of the new research that's coming out shows that only 60% of our genes actually express themselves at birth. The other 40% are turned on during life. So if you have one of these attacks, it overwhelms your immune system. Your immune system starts attacking you accidentally. It then turns on some of these unturned on genes, and you have this autoimmune attack forever. And it can drive this imbalance mechanism and stop it from getting better. It's actually something that can be kind of handled. And then the latest research also talks about insulin attacks, blood sugar attacks, and how insulin and blood sugar affect quite a bit, can affect an imbalanced system, an imbalanced vertigo system, which we're going to talk about here in a few minutes. So when you have insulin spikes, I don't know if a lot of you may. How many of you eat meals and crash afterwards? Does anybody do that here? Nobody? A couple? Okay. So you're either insulin. Are you diabetic? Okay. So but you're probably insulin resistant. Mild, okay. So you're probably insulin resistant, okay? Exactly, okay. And then those of you who maybe when you don't eat, you get a little cranky, you get a little bit irritable, you get a little shake. I see a lot more smiles on that one, okay? That's low blood sugar. And people are like, well, if you don't have diabetes, you're okay. No, because every time you get one of those shakinesses, your blood sugar goes up and down. It creates insulin spikes. It creates inflammation in the system. And if you have an imbalanced functional disconnection syndrome, it irritates it. And it kees it irritated. So you're starting to see how this works? Okay, we have multiple systems involved here. Primarily we have a brain. That's generally the center of it. Okay. Secondarily, we have different systems that drive it. This is the reason that you got it and it never went away. And then we have something called triggers. A lot of times we want to call this the cause. But I want to make this very clear, okay? A lot of people say, I got stressed, or I got anxiety, I got sick, and that's what caused it. It's not what caused it. What that did was it triggered the imbalance that was in your system that exacerbated the imbalance in your brain and kept it going. Does that make sense? I'm getting a lot of heads shaking yes. So, okay, I'm going to make this a little bit clearer here in a moment. Basically, that's what's causing what you have. Okay, and I'm going to get a little bit more specific here. Let's first talk about the different types of vertigo and dizziness and balance, okay? There's like tons. There's like a whole laundry list of them. I don't know. And I mean, just to let you know, I mean, we know it, that we know, we read the clinical books, you know, that the doctors read. We read the vestibular rehab books, okay? We do neurological differential diagnosis. I mean, if you decide that you want to get us to check you out, you'll get a better neuro exam than you've ever gotten in your life, because the neuro exam is hugely, hugely, hugely important. And it's kind of something that's kind of blown off today. We're looking for the audiology reports, and we're looking for the MRIs and the CAT scans, and they're mostly negative. And they tell you, well, you're negative, so there's nothing that can be done for you. But there's a lot that can be done. And so to do this, you need to be able to understand that. But we're not saying that this stuff's no good. We're just saying that all of this research is not going to fix your problem. And there's so many, like I started to say, there's so many different types of vertigo. There's vertigo with spinning. There's vertigo with you spinning. There's vertigo with the world spinning around you, okay? There's ataxia. I was at a seminar on autism this past weekend, and one of the kids there was walking like this. And we said, do you realize your son has ataxia? And she said, no, because she'd never seen him walk any other way. But ataxia is where you kind of walk with your feet spread, and you're kind of like not balanced and so on and so forth. That's a type of vertigo, dizziness, balance problem. They're all kind of, you're going to see, they're all kind of out of the same mold. There's disequilibrium. Anybody have that? Disequilibrium is like you're walking down this hallway and you just kind of like, you don't have a wide gate, you're just unsteady. You might want to put your hands out against the wall so that you're not, so that's a different kind. And I'll tell you what the difference is here in a few minutes. That's a different kind. Then you got like the old Alfred Hitchcock like vertigo, like Jimmy Stewart type vertigo. You walk into a room, and you just get overwhelmed. You look at, and you just get overwhelmed. I had a patient the other night who went to the UNR basketball game, and they walked in, and they came out, and they were like, whoa, and they couldn't get down. That's like a different type of vertigo, okay? There's that type of vertigo. There's BPPV. Has anybody here been diagnosed as BPPV? Okay, that's like the most common diagnosis. Now you may have it, and if you do, you're lucky because 50% of those will get better with an Epley's maneuver. A lot of you probably had Epley's maneuvers, and frankly, they probably didn't work on most of you. Some of you probably got worse. So a lot of most people who do them don't know how to do them right. I mean, I'm just telling you, okay? This is what we do. We're not messing around. This is like what we do, all right? So BPPV is one. That's the ear rock. And it's like still out whether that's even a real theory or not. I have mentors who buy it, and I have mentors who don't. We use it occasionally. You do this type of thing. You turn to the side and that type of thing. Just to the right, like when you'd lay over in bed.
I got bilateral.
Okay, bilateral. Okay, you probably don't have that though. You think? BPPV, maybe. That would be pretty weird though to have it on both sides. I've never seen it, so I don't know. We'll see. Okay. So anyway, that BPPV, that's kind of one that's the most common. It's catch-all. It's like when you got joint pain, you go to the doctor, you go, and they can't figure out what it is. You go, it's arthritis. You go like, well, yeah, but I'm only 21 years old. It's like, no, it's BPPV. Okay. So that's one. And about half the time, you'll get rid of that doing that Epley's maneuver. That theory is that there's rocks in the ear. They unposition themselves. When you do the maneuver, you get the rocks back in the ear. I actually don't buy that theory completely, but there is some validity to doing that Epley's maneuver on certain patients who have certain types of rotationary type of stuff. There's egocentric vertigo, where you're standing there and things are going around you. There's exocentric vertigo, where you're standing there and you're kind of going around things. There's like vertigos, like here, you get up in the morning and you lay down, you get up in the morning and all of a sudden everything starts going around, the egocentric, exocentric. You lay down at night and the roof starts going around. That's a different type of a vertigo. We had a little gal who ended up having severe seizures that we ended up just working on. It started out, once we took her history, she's 11 years old. Once we took her history, she had first started out with car sickness. Car sickness is a form of vertigo, dizziness and balance. For those of you if you've had it for a while, that is a form of, that's like you had it for a while. And like if you're in a car and you're like, somebody moves next to you and you go like that and you grab the wheel and you kind of get a little nauseous and that's vertigo. That's a dizziness, vertigo, balance problem. These are all similar mechanisms we're going to talk about in a second, okay? Or, all those things. Or if you're like driving along and the, and the poles are going like this and you're going like, man, you're starting to get nauseous. All of these are the same mechanism. They're different variations of the same mechanism. There's a lot more, okay? But just to let you know, there's a lot of different things. And dizziness, nobody knows what dizziness is. I mean, when you ask a patient what dizziness is, it's just kind of like this vague, like, oh, I just don't feel right. I just get a little nauseous. Lights make me a little blurry or dizzy, but a lot of times people just can't really explain it. So here's what's happening, okay? What causes good balance? You need to know what causes good balance before you know how it screws up. All right? Now, I got to tell you something. For the camera, I am a terrible artist, all right? So I'm getting better by the week, but not much. So here's how it goes, okay? This is you, all right? All right, there's a lot of things that cause bad balance. You could have a short leg and a pronated foot that you never knew, and you'd be walking around like this and tripping and falling, and you think you got dizziness and vertigo, and it's a short leg and it's a gait thing, and you need orthotics and a lift, and we've had that. We have people come in here who have been diagnosed as having vertigo and dizziness and balance, and we stick them in a lift and they're fine. So that gets the chiropractic part out of the way, okay? But what most people have is this, okay? What causes good balance? First of all, okay, let's just go with the inner ear for a second. Okay, we have an inner ear mechanism, and it has these three little canals, and it has this other thing that looks like a snail, and it has this inner canal, and that's what everybody thinks causes balance problems. Oh, it's my ear. Okay, it's my ear. It's a small part of it in most of you. It's a small part of it. Okay, so you have the ear that does balance. You have the eyes. Okay, the eyes, all right, tell you where you are in space. You know, it's kind of, when you don't have your eyes, it's like a little bit harder to be balanced, okay? So you have your eyes as part of the balance mechanism. So we have your ears. Your ears tell you, the inner ears tell you where your head is, okay? The eyes tell you where you are, okay? And then we have this thing called the parietal lobe up here. Okay, parietal lobe does something interesting. It collects all of the data from every joint and muscle in your body. This is important. So every joint and every muscle in your body has a balance mechanism in there, okay? And every one of them has it, and they all fire back to this parietal lobe. And this parietal lobe has to integrate that plus a bunch of other things we're going to talk about in a minute. So people who have scoliosis have bad balance. You have scoliosis, big curves, because they're like this, and all of the proprioceptors, they're called proprioceptors, all the balance mechanisms in their joints are bad. And they all have bad balance. Even if they're not in pain, they have bad balance. It's partially because they're curved, partially mechanics, and partially because they're not feeding back properly to this, okay? And they're hard to fix. Okay, if a person's got a big scoliosis, you're not going to have as good a result with the things that can be done. But here's the biggie down here, okay? We'll put this on the right. These guys down here, they're called the cerebellum, all right? The cerebellum is like humongous. It's right here. It's this little guy right here, all right? There's your brain. There's your brain. I don't get too technical here, but there's your front of your brain. This is the side. Down here, these little two green guys are your cerebellum, okay? One on each side. They just coordinate everything. They coordinate everything. They coordinate everything from your body to your brain and from your brain back to your body, everything. What they do more than anything else is they stop end-eye movement. They control all postural muscles, which is why a lot of people who have dizziness and vertigo and balance problems have neck aches and neck problems and tight necks and stiff necks, okay? They do a number of other things, but one of the biggest things that they do is they control balance. Like a zillion times more than your inner ear. Your cerebellum controls balance, okay? Now, here's how it works, though. Okay, the proprioceptors in your body are firing back to this brain. And then it's going through the cerebellum and it goes up to the brain. The ears are firing in. The eyes are firing in to this thing called the parietal lobe. And then there's one more piece called the frontal lobe. I'm not going to get too confused. Here's what I want you to get. How many pieces are there to a balance? How many pieces? How many pieces? We got the body shooting back there. We got the parietal lobe. We got the frontal lobe. We got the eye, we got the ears, and we got the cerebellum. Okay. If any one of those is out of sync, what happens? Depending on which one it is, you get any one of the numbers of things that I just got done telling you about. Visual vertigo, dizziness, disequilibrium, balance problems. Does that make sense? Does it make sense? That is how you get dizziness and balance and vertigo. For sure, okay? This is not a theory. I'm telling you that this is the way it is. You guys, I don't know why you're so lucky to be here, but you're like here on the forefront of a wave. Because how do we know this is the way it is? Because we treat this, and it gets better. Because this is how it works, okay? Remember we were talking about the functional disconnection syndrome. So something happens and it sets this brain off. There's an imbalance in one of these mechanisms. Somebody whacks you in the ear, you know? Somebody blasts you in the eye. You fall and hit your head on a rock, like the guy that he was in a snowmobile, and he fell and he hit his head on a rock, and he was out for 2 weeks, and so on and so on. And he's doing like enormously better because it took out his parietal lobe. He had a concussion in it. And so what did it do? It imbalanced his brain. I'm not saying it destroyed it. He didn't get a concussion. It created a frequency of firing that was imbalancing his brain. And so he got a certain amount of stuff going on. He's pretty wicked, and he's doing much better, okay? But depending on which one you get, how serious, how little, you're going to get dizziness. You're going to get vertigo. You're going to get balance. You're going to get it's inner ear. Well, your inner ear is okay. We checked it. It looks good. And we did the Saccades test on the machine, and that looks good. And we did this test on the machine. It all looks good. That's because it doesn't measure this, okay? And the way you do this is you do a good neuro exam. It's not that difficult to pick up if you know what you're doing, if you know how to do a good neuro exam. That's how it works. So you get that. Now you get this. Now let's say you have an autoimmune attack. Or let's do better than that. Let's say you have insulin resistance, okay? Let's say you have insulin resistance like this gentleman in the back, or low blood sugar like the rest of you who are going like that when I said are you irritable or shaky. And what happens is, let's say that blood sugar is going up and down, and it's creating what we call insulin spikes. Okay, insulin, you don't need, if you have too little blood sugar, then the insulin comes out, it hits the cell, it opens the cell, it pushes all the sugar in there, and you got all the sugar in your cell, and you don't have it in the blood. And that's called low blood sugar. That mechanism causes an inflammatory insulin spike. That feeds back to the brain. And it creates an inflammatory process in the neurons that are already susceptible and imbalanced. Why? Because they're weak. Okay? And a lot of you are going to sit here and you're going to say, you know what? I don't have thyroid problems. Most of you have low thyroid problems. How many people in here have low thyroid problems? 1, 2, 3, 4. That's it? Just 4? Okay, of you 4, 2 of you probably have an autoimmune thyroid. That's the stats, okay? Maybe it's not of the 4 in this room, but 50 to 70% of you will have an autoimmune thyroid. And if you're taking thyroid medication for it, it's making you worse. If you're taking thyroid medication and you can stop taking it and it doesn't make any difference, you have an autoimmune thyroid. If you stop taking your thyroid and you crash, you actually have a real, honest-to-God, low thyroid. So that is huge, and it feeds back to this, okay? But the reason I'm saying that is because a lot of people come in and go like, well, I've been tested. Well, I've been tested, and I don't have blood sugar problems, and I don't have autoimmune thyroids, and I don't have iron problems. You do. You do. I got to tell you, the way that we get tested today is, what did I say the word as I used today? Crap. I just can't think of a better word. It's just like, that's the way it is. If any of you are working in hospitals or labs, your heads are going to be shaking when I say this, okay? You're going to be going like this. Here's how we do it. We go to the lab. We use LabCorp, okay? Because they're cheap. Because we can get labs done less expensively than anywhere else. Okay? It's a mill and it works for us. All right? We just need the blood. We don't need them to be like, it doesn't need to be like the Ritz-Carlton or anything like that. But we use LabCorp, and here's what happens. So you go to LabCorp and you go into the one particular LabCorp where you're going to go. All the people who've come in there over all these years, okay, are in their computers. And here's what happens. All the markers go in there, let's say for blood sugar. Okay, all the markers go in there, and over the years, you get more and more and more people in there. And what they do is they cut off the ends. They do a bell curve analysis. They cut off the ends. This is high. This is low. This is normal. And as the years go on, the norms get bigger and bigger and bigger with testing who? Sick people. All right? So we have these incredibly wide norms, which the drug company was perfectly thrilled with, because the wider the norms get, the more medications you get to get. I'm not one of these conspiracy theorists. I'm just telling you the way it is, okay? All right? So that is not the way. So you go to the doctor looks at your blood test. He goes, wow, your sugar's like 113. It's okay. It's not bad. Well, it's supposed to be like 99. It's not okay, okay? But a lot of them will say it's 99, it's 100, it's okay, and we won't do anything until it's 101. Or we're going to treat you for diabetes until it's 125. That's not the way you do it. You got to look at a number of different markers. There are patterns that you have to look at. And the patterns will never change. You can look at the blood sugar one day and it'll be up, and the next day it'll be down, and so on and so forth. It's a 24-hour window. Some of you know what an HbA1c is. That's a 2-month window. It's a little bit more accurate. But it's not as accurate as taking 10 blood markers and finding out, are you really low blood sugar? Are you insulin resistant? Because I'm going to tell you, if you are, it's affecting your dizziness, balance, and vertigo. If you're autoimmune and you got dizziness or balance or vertigo, you will never get better until that autoimmune thing is quenched out. Nobody ever tests for that. And it's a simple test, but nobody ever tests for it. So you have to, we use something called functional tests. We use something called functional lab norms that were established by the National Chemistry Association that oversees all these labs. And they put these norms together. And they're based on healthy people and what healthy people should look like. And they're much less forgiving. And so you pick up things a lot more and a lot quicker and a lot more specifically than what's going on in the labs. And that's why you have to look at the brain, and you have to look at the labs, and some of you even need to look at the musculoskeletal system, and you need to look at it all at once. Otherwise, you're looking at going to one guy who's looking at your foot, you're looking at another guy who's looking to adjust your atlas, you're looking at another guy who thinks you got like blood sugar problems, you're looking at another guy who thinks you got an ear problem, and you just go on and on and on and on and on and on forever. It's not like that, okay? It's a multifactorial problem that needs to be looked at all at once. So you have this. So you have this brain dysfunction. Now you come in and you go to the lab, and let's say you find out you have an autoimmune thyroid. An autoimmune thyroid or an autoimmune anything. An autoimmune thing, what it does is it causes your imbalance in your immune system, and that sends, or let's say you have too much iron. So a lot of you don't get tested for it. I have people that come in here and you get tested for low iron. So people, they look at your serum, they go, oh, you got low iron, I'm going to give you iron. But they never do enough tests to look at something called your ferritin levels. Does anybody know what that is? That's the level of iron in your cell. We had a guy in here not long ago, dizziness, vertigo, everything. Oh my God, this guy was like horrendous. And they were giving him iron because we don't take enough tests, because they're not considered medically necessary by your insurance company. That's my one political thing, okay? And they were giving this guy iron. You should standardly do a ferritin along with an iron. Nobody does it. This guy's ferritin levels were off the charts. It's called hematochromatosis. It is a life expectancy of 55 to 65 years old. It kills you. It also creates tremendous inflammatory responses, which affects everything in your body. If you have a functional disconnection imbalance here, and you have blood sugar spikes, or you have other inflammatory, I could go into tons of things, gut problems, and it's feeding back to this, you are never getting better. In fact, you will stay better, or you will continue to get worse, which is where most of our patients are when we get here. So it's not whatever set you off that caused this. It wasn't the car accident, technically, or it wasn't the birth, or it wasn't the virus or something. That was the trigger. The trigger set the endocrine stuff off, which you're never going to find because they don't test for it, because it's not medically necessary. And then that sets the brain thing off. And you could, I mean, you know, if an accident like the guy that we had, you know, gets hit in the head, obviously that'll set off. But if it gets set off normally, this is what's going to keep it driving. This is what's going to keep driving it, and this is what's going to keep it from getting better. So this is what dizziness and vertigo and balance are. Your cerebellum is the biggest player. Do you get that? Cerebellum. I didn't say inner ear. I said cerebellum, okay? All right? So that's really the big player. So how do you deal with this, okay? How do you deal with this? How you deal with this is you have to do, first thing you have to do is like, well, what's the standard treatment? What's the standard treatment they've been? First standard treatment is medication, okay? Well, you've been on meclizine, you've been on, you know, you've been on these different medications, and some of you feel better from it, and if you feel better from it, good, okay, good. But most people feel better from it, or they feel better from it for a little while, or they feel better from it, and it makes them sick from the side effects or whatever, can't take it. I've never known a medicine to fix somebody's dizziness, balance, or vertigo, okay? Fix it. I've never seen that happen, okay? And then what's the next thing? The next thing you can do is nothing. You can do nothing. Well, all your tests are normal, so just live with it. You can go to physical therapy, and physical therapists do Epley's maneuver. And if you happen to be lucky and have Epley's maneuver, you might get improvement. Okay? So that's 1/2 of one of those conditions that might get improvement. Everybody does it. A lot of the physical therapists. I have physical therapists for friends. We had a whole department here for years. But a lot of physical therapists don't understand. They just understand Epley's dizziness, boom, boom. They'll make you worse. How many of you puked while you did it, after you did it? Yeah. So you can go to physical therapy, and if you have Epley's, it'll help you. If you have BPPV, it'll help you. If you don't, it's going to make you worse. It doesn't have a chance, because it's going to continue to imbalance this as they're pushing your head around. Okay. You get shots in your ear. Anybody here get a shot in your ear? Nobody here got a shot? First time I've had somebody who hasn't gotten that. They stick a shot in your ear, they kill cells. Also, frequently, about 50% of the time, you lose your hearing along with it. You might get temporary relief, and then usually it'll come back within 6 to 12 months. Or they go and cut the nerve. Anybody here have their nerve cut? Okay. You want to have this cut, and what does it do? Again, okay, I'm not being disrespectful here, but you cut the nerve because this mechanism is still considered experimental or not well understood in the medical field. You want to cut the nerve and imbalance that whole thing, and that's what happens. Okay, and lose your hearing. Okay, so those are the standard treatments for it. Those are traditional treatments for it, and they don't work. They just don't work. If you know somebody that's worked for you, tell me. I mean, I don't find anybody that any of this stuff has worked for. The medications seem to do the best. They give some temporary relief to a percentage of people, and then after a while, they stop working, for the most part. Okay. What you have to do is you have to take this imbalance and make it work. Functionally make it work. So remember, we have this fancy word called the functional disconnection syndrome. Boy, I must be standing wrong. This is the first time I've seen you tonight. I'm usually, this gentleman over here, I'm usually like, no, the gentleman behind you. It's the first time I've seen your face tonight. I'm standing over here and I don't see you. Usually I try to make eye contact with everybody. I'm like, whoa, there's a new guy there. So, yeah, so what we have to do is, remember I said, if you have a functional disconnection syndrome or an imbalance, you can strengthen it. You can rehabilitate it. If you think of it as muscles, here's how it goes, okay? You have one side of your brain is going to be not functioning as normally as the other. There's going to be, once one of these pieces go, this just happens, okay? It's going to be one side or the other. You have to find out which side it is, and you do that through a neurological exam, and then you have to strengthen it. Now look, how do you strengthen a brain? Can it be done? We're not talking about the ability to make you feel better. We're talking about the fact that your brain has the ability to heal. Exactly. And this is something called plasticity. It's all over the internet. You want to look at the word plasticity on the internet. You can read it and all that type of stuff. And efficiency of the brain. Okay. And what happens is you have things called neurons. Those are your brain cells. And they're like little muscles in there, okay, except much more powerful, all right? And it's been shown scientifically that when these neurons in these areas are not functioning right, they get smaller. Just like your muscles get smaller when you don't use them, okay? And the neurons get smaller. And one side of the brain, as it gets more weak, the other side of the brain frequently will tend to become a bully and like actually take over. So it actually keeps getting worse and worse and worse. So you need to get into this part of the brain where the weak neurons are, and you need to make them strong. And you can do that, okay? And you can do it with simple, non-drug approaches, like light, like vibration, like heat, like little electrical stimulations, like exercises. So let's say over in this area of the brain, let's just say we got weak neurons in your parietal lobe that we find in a neurological exam, okay? How do you fix that? Well, the parietal lobe wants to know where the things are over here, okay? That's what when you think where is that? That's your parietal lobe firing off. So this might sound extremely simple. It's simple once you figure it out. But we might have you put your hand in a bag where you can't see anything and start feeling different like objects. And as soon as you feel that objects, those objects are going to fire off these neurons in this brain. The brain needs, the neurons need two things. They need fuel and they need activation. all right? Activation comes in the form of muscle. If you have a bad triceps, what are you going to do? You're going to exercise it. You're going to activate it. You're going to do the same thing with the brain. But you have to find out what part of that brain is doing what. So if it's a part that responds to light, we might shine light in a person's eyes. If it's a part that responds to sound, if it was, let's say, your temporal lobe, we might put music in one ear to strengthen the neurons of the other. And it's amazing. You'll have people who can't even stand up, and literally within literally 30 minutes, you can close the person's eyes and they'll be solid as a rock if you hit the right neurons. And it's like going to the gym. You kind of got to do it over and over and over again for a while until the neuron strengthens. And what the neuron does is it doesn't get bigger, it gets denser. The difference between Albert Einstein and us was that his brain was not bigger, it was denser, his neurons were denser, and they had more connections. By continuing to stimulate these neurons, okay, these little brain cells in your cerebellum or in your parietal lobe, wherever we find they need to be done, they get thicker, they get more concentrated, they get heavier. I don't know how they weigh them, but the research says they get heavier, okay? And they get more connections. They actually start to recruit other brain cells, this is called neuroplasticity, from around them to get stronger to bring this back into balance because they need more strength to bring this thing back into balance, okay? Is that a temporary or a permanent thing if you do it? It's a permanent thing. It's a fixing the problem. It's not a patching it over with the medication or something like that. It's actually fixing the problem, okay? Now, the other thing that neurons need to be healthy is fuel. It needs oxygen and it needs glucose. You notice I keep coming back to glucose? Now, there's a lot of things, but this is the reason I emphasize good. There's probably 8 different things that are screwing you up, okay? Probably the best way of putting it. That's probably 8 or 10 different things that are screwing you up, okay? Your diet. But glucose is the biggest, one of the biggest ones, and the autoimmune thing is the other biggest one. The iron can be a big thing. Gut infections can be a big, parasites can be a big thing. They're much less, they exist, you got to look for them, okay? But they are there. But glucose, it goes into the system, and again, I go back, I briefly covered it. Glucose goes to the brain. It's the only nutrient that goes to the nervous system. The neurons need even glucose. It doesn't need low blood sugar when you get shaky, and it doesn't need you crashing after you eat. Those all create imbalances in the system. They create inflammatory processes. They cause the blood sugar to go up, and they destabilize the neuron, which you're trying to exercise, okay? And by the way, this exercise, the neuron, you do it on one side. Everybody knows, like, left side, right? Right brain, left. So if you go in and you try to stimulate it on both sides, you get this, okay? You don't get this. You got to stimulate just the weak side. So you'll notice if any of you decide to do this.
Tinnitus. I got tinnitus.
We do tinnitus. Tinnitus has a lot to do with the fuel delivery, has a lot to do with the iron, has a lot to do with the inflammatory type of processes we're talking about, and that's what we do, and we treat tinnitus. You don't look like you're convinced, but that's okay. That's how we treat it. Okay, so that's okay. So we talk about food. So the blood sugar has to be like this, not like this. Okay. So you need to look at the blood sugar, and you need to get the blood sugar leveled out, and we eat plenty of sugar in this country, and it's too much of a problem. You need to look at things like that. You need to look at the other things, like what he just asked about, frankly. Tinnitus, a lot of times, do you have Meniere's, or do you just...
Oh, I have it all.
Okay, because we have a lot of Meniere's patients, and the Meniere's patients, I didn't mention that one. There's another one. You got Meniere's, and they have dizziness and vertigo, tinnitus, and loss of hearing. Okay, and they get better when you do this. Okay, when you do this. Fuel delivery is huge for you. It's huge. So for the tinnitus patients, and temporal lobe and is huge for you. So you get actually another lobe that I didn't even mention in here. Okay, that's how it works. All right. So you need the proper fuel and you need the proper oxygen. Okay, you can't get oxygen into your cells if your fuel's not right. We use oxygen here. We use oxygen while we're treating patients because we don't have time to wait for a year while you get your metabolic system right and your oxygen levels start coming up, because after the age of 25, you start utilizing your oxygen less. And what occurs is it's harder for the nervous system to respond to what you're doing if you don't have oxygen. So we actually use oxygen concentrators here while we're treating people. That's how you get better. If you go to the gym and you're working out and you're getting your muscles all up, but you're drinking and you're smoking and your oxygen's no good and you're eating a bunch of junk and all that, it doesn't work very well, huh? I mean, it's not working as good, does it? Same thing with your neurons in your brain. So that's why we need to look at the metabolic thing. You are one person. I don't care whether it's peripheral neuropathy or fibromyalgia. I don't care whether it's autism. I don't care whether it's ADD, ADHD, or any other chronic pain syndromes that we said. It's all the same workup. You have to find a part of the nervous system that's screwed up. You have to find the imbalances that are driving it. And in many cases for the kids, you have to find the triggers for these autistic kids and stuff like that. But it's the same basic principle. It's kind of like Eastern medicine made Western, for lack of a better term. Okay? You got to look at the whole body. It is all connected. Trust me, it is all connected. And it takes a little bit of work to figure that out. That is what dizziness and vertigo and balance is. Imbalance in the brain, driven by metabolic imbalances, usually set off by some sort of a trauma or some sort of imbalance or some sort of a virus or an infection or something like that. What we do with it is we bring people in and we look at their nervous system critically, okay? We have patients fill out, how many pages is that? Just so I can let them know. 15. We have patients fill out a 15-page history form. Wow. And here's what I tell patients. If you're not motivated enough to fill out that history form, you're not motivated enough to be a patient here. Because in case you don't get it, there are lifestyle changes to be made to get a permanent correction out of this. People need to change their diets. Some people need to get off of gluten. Anybody hear of the new gluten thing? Does everybody know what gluten's in? Yeah. Yeah. Tell what's gluten in?
I don't know.
Oh, you didn't say you don't know. You said wheat. It's in everything. Oh my God, it's in everything. You know, if you got to get off of gluten. I mean, we got this little girl. She was having seizures. She'd been where she tried everything. We were working on her. She was getting better. We got her off of the gluten. We got her off the casein and the soy. Within 5 days, she was totally normal. Now, it may sound crazy, but I got to tell you, this is the new medicine. This is where it's going. This is contaminated food supplies. I can go on for this for the next hours, and you don't need to do that because I don't want you guys to like get mad at me for keeping you too night. So gluten, G-L-U-T-E-N. Okay, it is a wheat deal. But that's what people think. But it's wheat. It can be. There's cross-contamination. It can be wheat, oats, barley. It's actually not oats, but it gets contaminated. White rice gets contaminated by it. I mean, it's a mess. You can't eat bread. You can't eat. It's in soy sauce. It's in mustard. It's in ketchup. I mean, it's in everything. You end up eating like the way we probably should eat. You know, like meat, vegetables, pretty clean. You lose weight. You feel better. All that good type of stuff. But anyway, and you drink water and you drink tea. I mean, it's really something. But we have a lot of people who have to do that. So that's what I'm saying, okay? I mean, so we have people fill out quite a history because we can see these patterns in the history. We have a metabolic assessment form that we ask you to fill out. It tells us what your systems are. We have a neurotransmitter system that we have people fill out. And I tell patients, don't come in if this isn't filled out. I won't see you. It's that important. We're not looking to be messing around here. If we accept the patient, when we look at him, you're getting better. I'll tell you that right now. You might get 70% better, 80% better, 90% better, 100%. You'll get 70. With our dizziness and vertigo patients, we pretty much shoot for a full recovery. We don't get too many that we don't get a full recovery on. We get a few that only get a 95% recovery, okay? I mean, truly, I mean, we haven't had anything less than that. But it's complex. You got to look at this. You got to have the data. So if you're not willing to do the data, don't take advantage of what I'm, of what I'm going to tell you in a few minutes. But that's what we do. We get all that data, and we schedule the patient for an hour. I don't know when the last time you spent an hour with your doctor, but we schedule you for an hour. About 30 minutes of sitting down, going through that history, and digging, Make sure we don't miss anything. And then we do a neurological exam, which isn't quite as extensive for you guys as it is for some other guys because it's pretty clear. We know the mechanisms, but it's the more extensive than anything you will ever have experienced. And we'll look at all your tests that say that you're negative, and we'll look at all that type of stuff, and we look at that whole thing. And then what we do is we take our patients in the back, and we start doing stimulants to them to find out which stimulants are the ones that are going to strengthen your neurons. Because everybody's a little different. Some people are going to respond to sound. Some people are going to respond massively to vibration because it's more their cerebellum. Some people are going to respond to this. Some people are going to respond to a TENS unit. Some people are going to respond to light. We got to figure that out. What is the response? And your nervous system should respond rapidly because you are your nervous system. You are your nervous system. You are your brain, people. I mean, everything that you are is right here in between these two ears. Okay? So if we shine a light in your eye and you don't respond, we have a problem. But if we do a neurological test and we find out that your eyes break down when we do this, or if we find out we close your eyes like this and you drop over, or we have you put your feet together and we have you try to do your nose, I shouldn't tell them how to do this because they're going to go home to do it and they'll practice, and then we won't have a good, thing. And then you miss your whole head or you miss your whole face, and then we go out there and we stimulate and we hit the right neurons, and you go like this when you try to hit your nose doing the drunk test, and we stimulate, and the next thing you know, you're right on the money. We know we've hit the right area. We know you're going to get better. And if you don't have a response, we know we don't have a prayer. So we don't accept everybody, okay? If you're not willing to change, and that will be reflective in your paperwork, this is a no-go for you. Because if you want to you're going to have to change. I do like 40% of the work. We spend a lot of hours sitting here poring over the stuff on Tuesday and Thursday mornings, but you're going to have to change. If you're not willing to change, don't sign up to see us, okay? And then we do that the first day. And then we see if the person changes, and we also check a person's metabolic capacity. Here's what that means. One of the stimulants that we use, by the way, I am a chiropractor, okay? One of the most powerful stimulants to the brain is a chiropractic adjustment. How many of you had one and got worse? There you go. It's okay, okay? People did not understand your metabolic capacity. So did they adjust you again after that, or did you just never show up again?
I went back again.
You went back and they did it again, okay? Shouldn't have done that.
Well,
shouldn't have done that.
got better.
Okay, that's good. But for that day, they exceeded your metabolic capacity. And your metabolic capacity is accumulation of all this stuff. How bad are your neurons? How many systems are involved? Do you have a blood sugar problem? Do you have a blood sugar problem and an iron problem? Do you have a blood sugar problem and an iron problem and a Helicobacter pylori in your gut? And all of that stuff breaks you down and makes your neurons more sensitive. So we need to figure out how sensitive are you, okay? So if you're like really sensitive and we stimulate you too much, whether it's with an adjustment or electrical stim, you're going to get worse. And you're not going to like us and you're not going to come back. So in the first 2 days, we figure that out. What does that mean? It tells us, are we going to be able to treat the patient? Are they a candidate? Are they not a candidate? How long is it going to take? If you have a low metabolic capacity, it's going to take a while. If you just have a parietal lobe problem and a cerebellar problem and nothing else, it might take 90 days. If you have a parietal lobe problem, you have a cerebellar problem, you got blood sugar problems, you got hematochromatosis, you got all the other junk, you got gut problems, it might take a year because you have to clean all of that up. Does that make sense? You see how it's not a one-size-fits-all type of thing? That's how it is. And that's why the medical model doesn't fit, okay? And we do a lot of testing. Once we figure that out, we decide whether to accept the patient or not. And then we'll let you know if we would accept your case or not. If we accept it, then we go on and we do a lot of testing. And we test for all the stuff we just got done talking about. And it might sound like a lot of testing. I'm talking about testing for all these different things to make it out. And it is. And, you know, it is a lot of testing. But if you really want a permanent correction, that's what needs to be done. And a lot of people are going to come in and go, will my medical doctor do this? And my answer is going to be, most of the time, no. Why? Because they're bad guys? No. Medical doctors don't go into the field because they want to be bad guys. It's because the insurance companies don't allow them to do this testing, because here's how it goes. Remember I said we don't use this normal generic diagnoses of vertigo. Here's how it goes. You go to the doctor goes, you got vertigo. Here's what that means. You are now allowed to do certain tests as the doctor, because the insurance company says you can do these tests. So they do those tests to you, and the tests come out negative, And it's like, okay, you're done. You can't do anything. Or you can give a drug. Or maybe the test comes out positive and you can go to a physical therapist and get an Epley's. Or maybe the test comes out positive and you can go get another test. But that's how it's run. It's very run much like that. That doesn't fit you, okay? You're not going to get the number of markers that you need to get to clearly look at your entire system in the system because it's not considered medically necessary. This is my one bad joke for the night. Medical necessity is defined basically as the least amount the insurance company can do to get away without getting sued for you paying your premiums to them. It's a bad joke, but that's what it is. Believe me, because we don't do that. Okay, so your test may not be covered by insurances. We are involved with co-ops where we can get a lot of testing done for almost basically what your copay would be anyway. If you just pay us and we pay them cash, and then we get what we need because they don't give us any crap. Crap, I said it again. And they don't give us any crap. I said it again. and we get what we want because nobody cares because there's nobody telling us this isn't medically necessary. And if you don't think that this stuff's medically necessary, ask our patients who couldn't walk in here, who came in here and were sick and who were puking, who were disabled, who couldn't work, who now have 2 and 3 jobs and were working 50 and 60 hours a week and leading normal lives again. They thought it was medically necessary, and it is. We don't do anything that's not medically necessary. So that's how we do it. And then we put together a program based on all that. We tell people this is what you're going to eat, this is what you're not going to eat. This is how many times you're going to eat. It's different for everybody. You might take supplements. You may need no supplements. You may need supplements for the rest of your life. You may need supplements for 4 weeks. We don't know until we do all the evaluation. We do home programs. Because why? Because how do muscles get better? By working them out. Once in a while or kind of regularly. Well, let me tell you, neurons get better by working them out all the time. Listen, you want to stop getting old right now? Start forcing yourself to think. Start forcing yourself to learn something new every day. Every time you learn something new, literally little atomic explosions go off in your neurons, and you create new connections in there, and your aging is coming from your brain. That's how you age, and all the crap that you're dumping on that brain and making it inflamed. Okay. But we would tell you this is the crap you're dumping in your brain. But we would also tell you you need to go home and do these exercises. So we give home programs, and they're not hard, but you got to do them. And if you do them every day, your little neurons in there get stronger and stronger, and they get thicker and thicker, and all of a sudden, guess what? You're better. You're not covering up the symptom. You're actually correcting the problem. Okay? No drugs. No side effects, unless we exceed your metabolic capacity. And then we only usually do that once or twice. And then we learn that that's your capacity and so on and so forth. And that's how you do it. And it works. And I got to tell you, it's pretty profound. Of all the things that we treat, dizziness, vertigo, and balance problems respond the best. I didn't say the quickest. We get the highest percentage of high corrections on that. I got to tell you, in the last year and a half, we've had one that has not corrected 100%. We got 1 or 2 right now that I think are going to go, but we're still not sure about, but they're way better. I mean, here's people who were totally disabled, couldn't do anything, couldn't even turn on bed, were puking and, and the whole thing. So they respond really well once you figure it out. So that's how it is. That's what dizziness and vertigo and balance are. That is, I'm telling you, I don't know if you get to hear this from any doctor. I'm telling you 110% for certain, for sure, this is what it is. It's not an inner ear problem, okay?